Hi, ladies. My name is Crystal Melanson. I am a board certified holistic practitioner and nutritionist, and I help women and couples maximize and mend their fertility naturally. So, today I want to talk about a topic that can sometimes be heavy, miscarriages, and what we can do about them, right? So, I know many of you in my community have experienced miscarriages before, and for that, my heart goes out to you. I know it can be incredibly painful and a hard thing to talk about for some of you. And if you haven't experienced one, then I am betting you know someone who has. If you don't, you just probably aren't being told because they are common, right? So, especially in the fertility world with those that have been struggling, we can hear about them pretty often. So, I want to help work through this topic a little bit with you today. Um, when I work with clients, my goal is to really help them have an understanding of their body, right? Try to have answers when they're struggling with health or fertility, and to support healing, being proactive, right? Preventing issues as best as possible. That's really, I think, is important. And when it comes to miscarriages in the conventional world, especially, there's not a lot of support. Definitely not proactive support. You're told to wait often. You're just told miscarriages are common, and you're told to just start trying again, right? And maybe again and again and again, because normally they don't even really assess you until you've had 3 or 4 losses. This is tragic to me. This is so sad, because why would we want to wait, right? To go through that pain when there's so much that we can do to help prevent this, to try to be proactive before you ever even get pregnant. Before you ever get pregnant that first time, right? We can do things to try to help. And there is evidence that shows even that the reason why you might experience the first miscarriage could be the same reason, is likely the same reason that you would experience the third or the fourth. So waiting is not going to help the situation, right? So we want to question what could be going on. And no, it's not your fault, right? If you've gone through this isn't your fault. There's no shame, there's no guilt in it, but we want to try to help you to have answers, to have understanding, to be able to forward and heal, right? Because you can reduce your risk through proper assessment, through diet, through lifestyle, through individualized supplementation. And that's what I want to talk a little bit about. When I start with my clients, the first framework that I start with is called the body reaction assessment. And there's a couple pieces to this framework, to this assessment, but one of them includes markers for assessing miscarriage risk. Now, after that third or fourth one, right, when your doctor wants to maybe give you their own assessment or a physical, that can be helpful. But this is often not enough. It's often very surface level, and it doesn't really get to the underlying reason of what could be going on, assessing why, right? Reducing the risk. So the markers I like to use, they are rarely, actually, I have never seen a client have them done by their conventional doctor and or their specialist, right? So these are markers that are closely tied to risk off of evidence. And so when we go through some of those, when we look at some of these markers, we can see what can we do to lower your risk. Are they in the optimal zone, right? Because just baseline is not okay, right? Just normal is not normally okay. We want you to be optimal. And if it's not there, then it's not just giving a pill to try to fix it. It's still figuring out why. Why is this low in the first place? Why is this out of range in the first place? Because that is where we can really start getting some understanding and helping your fertility. So for an example, ferritin, right? If your ferritin or iron is low, then why? We need to understand that to help restore your fertility. For example, iron, ferritin levels are often related to gut health. They're very closely related to your gut microbiome and gut health. So maybe that's an area we need to assess. We can assess your dietary habits and what you're doing, but maybe we need to take a closer look at your gut health. Are we doing what we can to support that, your digestion? Because that might be one of the underlying reasons why you're struggling with ferritin or iron, which could be affecting your miscarriage risk, right? We want to take it further, these steps further to really help support you. And another part of this first framework is the realization that you're not just a number on a piece of paper, right? Testing's good. I like it. It can be crucial. But we need all of the information, from the past, from your history, your health history, how you feel now, other symptoms that are going on with you, what else is happening in your experience. This is all really important to have the holistic, comprehensive approach, right? And so, ladies, I actually created a new assessment quiz that I just made, and I want to give it out to some of you. So it's one piece that can help give you a start to help figuring some of these things out and where we want to look. So if you want that quiz, if you want that assessment, shoot me a DM or comment below. You can just comment like quiz below and I'll get that over to you. So that's something that can be a piece help you have some understanding. But what else do we want to know? We want to know what could be influencing you. Autoimmunity, thyroid, digestive issues, right? There's underlying reasons to those. What are they? A past of trauma, past of eating disorders. Did you used to party a lot? Medications, right? All of these things play a part in your risk and help us with your assessment to have that strategy, to formulate that strategy, to not just reduce risk, but increase your success of a healthy conception, like increase your chances of getting pregnant in the first place, having a healthy pregnancy, but also having a healthy baby, right? And doing better postpartum. So some other things that we're looking at with risk that's been shown, your blood sugar balance, your insulin response, your inflammatory response, checking in on these conditions like PCOS, right? These can all be helped through diet, through the right diet for you. Approaches have been shown to be more effective than medications, right? Even more effective than medications, and can be better longer term for pregnancy and in your long-term health. So really looking at that, your blood sugar balance, right? Egg quality and sperm quality. We can influence it through diet, with the environment, with supporting your natural detox pathways. And this can take some time. So 3 months, if we have 3 months, that is best that we can do to dedicate to this. Because we know that many miscarriages can be linked to chromosomal abnormalities, right? So it isn't something though that you just have to accept and do nothing about. We can help change that. But it's going to happen, the influence is going to happen before you conceive, not afterwards. So that's why being proactive can be especially important. It's not about how many eggs you have, but what is the quality of the ones that you do have, right? So there's a lot that we can do, but it's looking a bit deeper. It's looking holistically, comprehensively at you. And when we want to lower miscarriage risk, we want your immune system, your nutrient status, your environment, your gut, your diet, all of those to be optimal and right for you. So not to overwhelm you, but to actually take away the overwhelm, to take away the stress and the anxiety, because you're feeling proactive, right? That is where you feel empowered. Um, Offline. Oh, am I back? Okay. So I cut out for a minute. I hope this is going through. But that's where we can really have the influence, right? So if we can get your male partner involved, that's even better. Getting your male partner involved as best as possible, because it's not all on you. It's not all on the female, right? That can lower the miscarriage risk, especially if you've already had one. Then we do really want to try to look at the male partner too. If you're doing fertility treatments, right, IVF, we want to support the underlying reasons why you might be struggling with your fertility in the first place, because that could influence your success. That could influence your risk. And so if we are supporting the underlying reasons that might be struggling with, sure, you might be able to get pregnant naturally, but also it's going to help lower these risks too. Because if we can nudge that in the right direction, like that's really worth it when you're undergoing, right? We want to be proactive, right? We want to feel empowered. We want to know that we're doing what we can. This changes the whole journey, because you can't ultimately control the outcome, right? But you have so much influence for your health, your risk, your baby's health. And that can bring with you a peace of mind when you do get pregnant. That can bring some peace, that can bring some calm, because we obviously don't want to be super stressed when we get pregnant either. And so there's no guilt, there's no shame. These things can happen. They can happen to the healthiest of individuals, right? But with information comes power. With strategy comes power. It comes calm. And you have not been told this because, like I said, we live in such a reactionary system, right? Where, especially in women's health, you're made to feel you're a victim or you're at the mercy of the medical system or the universe, right? And that is just not true. With miscarriage risk, we need to support your body, help understand it, help understand why it could be having a hard time, and really work to take care of all the pieces for you. So once again, if you want that new fertility assessment, that quiz that I created, please shoot me a DM or comment below and I will get that over to you. If you have any questions on this topic, any concerns, you can also put those below and I'm happy to always chat with you. So I hope you guys have a wonderful afternoon.